Oral sex is often seen as a safer alternative to intercourse, but the reality is far more complicated. Many people underestimate the potential risks involved because it doesn't lead to pregnancy, but sexually transmitted infections, STIs, can be just as easily transmitted this way, sometimes even more efficiently. Viruses like herpes, HPV, and hepatitis can spread through direct contact with infected skin or fluids during oral sex, and in some cases, you might not even see visible signs of infection before transmission occurs. What's even more concerning is how many individuals, especially younger people, skip protection entirely during oral sex. This leaves them vulnerable not only to common infections, but also to serious health consequences like oral cancers linked to HPV. The mouth, throat, and gums can be entry points for bacteria and viruses, especially if there are small cuts or sores you aren't aware of. It's also worth noting that oral sex can create a false sense of safety in relationships where partners assume they're being careful, simply because they're avoiding intercourse. True sexual health means understanding that every sexual act carries some level of risk, and being proactive with protection, regular checkups, and honest conversations is essential to staying safe. Here are 4 main topics on this speech. Oral sex is often wrongly perceived as a safe, sexual activity because it does not carry the risk of pregnancy. However, this perception can be dangerously misleading when it comes to sexually transmitted infections, STIs. Many people don't realize that infections like herpes, HPV, gonorrhea, chlamydia, and syphilis can be transmitted through oral contact just as easily as through vaginal or anal intercourse. In fact, for some infections, oral sex can be an even more efficient mode of transmission because the delicate tissues in the mouth and throat are highly susceptible to microscopic tears that allow viruses and bacteria to enter the bloodstream. One of the most deceptive aspects of oral sex is that a partner may seem completely healthy and free of any visible symptoms, yet still be contagious. Herpes, for example, can be transmitted even when there are no active sores. Similarly, HPV often causes no immediate signs, but can linger silently in the body for years, causing damage over time. This means that relying on appearance as a measure of safety is a dangerous gamble. The casual nature in which oral sex is sometimes approached, especially among younger individuals, adds to the problem. Many skip protection entirely because they believe the risk is minimal or non-existent. This lack of precaution leaves them exposed not only to the more well-known STI, but also to less discussed risks like oral thrush, hepatitis, and other bacterial infections. What's more, certain STI acquired through oral sex can have long-term and life-changing consequences. Oral and throat infections caused by HPV, for example, are now recognized as a leading cause of oropharyngeal cancers, which are on the rise globally. Gonorrhea, once easily treated, has developed drug-resistant strains, and contracting it orally can make treatment more complicated. Ultimately, the belief that oral sex is safe simply because it bypasses the risk of pregnancy ignores the reality of how infections spread. The only way to truly reduce risk is to treat oral sex with the same caution as any other sexual activity, using protection, limiting the number of partners, and getting regular STI screenings. Without this awareness, people unknowingly put themselves and their partners in harm's way, believing a dangerous myth that can have lifelong consequences. Human papillomavirus, or HPV, is one of the most common sexually transmitted infections in the world, and one of the most misunderstood when it comes to oral sex. Many people associate HPV primarily with genital warts or cervical cancer in women, but fewer realize that it can also be transmitted through oral contact, and the consequences in the mouth and throat can be severe. Even a single exposure during oral sex can transmit the virus, and because HPV often shows no visible symptoms, both partners may be completely unaware that an infection has occurred. HPV has many different strains, some relatively harmless, but others are considered high risk because they are linked to certain cancers. In the context of oral sex, the most concerning are those that can cause oropharyngeal cancers, which affect the back of the throat, the base of the tongue, and the tonsils. Over the past 2 decades, these cancers have been rising dramatically, particularly in younger adults who may not even consider themselves at risk. Unlike smoking-related throat cancers, HPV-related cancers often occur in people with no history of tobacco or heavy alcohol use, making the link to oral sex more alarming. One of the most dangerous aspects of HPV is how silently it operates. The virus can remain dormant for years before symptoms appear, meaning a person could have been infected long before any signs of illness emerge. By the time a diagnosis is made, the cancer or condition may already be in an advanced stage. This hidden timeline makes prevention and awareness even more critical. The casual avoidance of protection during oral sex fuels this problem. Many individuals are willing to use condoms during intercourse, but skip any form of barrier when engaging in oral activities, assuming it's unnecessary. However, condoms and dental dams can significantly reduce the risk of HPV transmission when used correctly. Vaccination also plays a powerful role in prevention. The HPV vaccine, initially promoted for preventing cervical cancer, has proven highly effective in reducing oral HPV infections as well. Public health experts now recommend it for both men and women before they become sexually active. But even those who are already active can benefit from its protection. Understanding that HPV is not just a genital issue but a serious oral health threat is the first step toward reducing its impact. Without this knowledge, people may continue underestimating the real risks that oral sex carries. Many people don't realize that the mouth is far from an impenetrable barrier. In fact, it's full of potential entry points for bacteria and viruses, especially during oral sex. The soft tissues lining the lips, cheeks, gums, and tongue are delicate and can easily develop microscopic cuts or abrasions, sometimes without you feeling or seeing them. Everyday activities like brushing your teeth aggressively, flossing, or even eating crunchy foods can cause small injuries in the mouth. When these are exposed to bodily fluids during oral sex, they provide an open doorway for infections to enter the bloodstream. Gum disease, cold sores, or even minor irritation from braces or dentures can also increase vulnerability. People often underestimate how these seemingly harmless oral health issues can heighten the risk of contracting sexually transmitted infections, STIs. For example, herpes simplex virus can easily spread if there is direct contact with a sore, but even in the absence of visible blisters, the virus can shed and infect a partner through these. Microtears, blood-borne viruses such as hepatitis B can also be transmitted if infected fluids meet an open wound in the mouth. Similarly, bacterial infections like syphilis or gonorrhea can take hold in the throat, leading to painful symptoms, or sometimes none at all, while still allowing the infection to spread to others. In recent years, there has been a noticeable rise in oral gonorrhea, and certain strains are becoming resistant to antibiotics, making prevention even more important. Another overlooked factor is oral dryness. Saliva naturally contains enzymes and antibodies that help protect against some infections. But if the mouth is dry due to dehydration, smoking, or certain medications, its defense system weakens. This can make it easier for pathogens to survive and multiply after contact. The problem is compounded by the fact that oral injuries or infections are not always obvious. You might assume your mouth is perfectly healthy while unknowingly having conditions that put you at higher risk. This makes regular dental checkups an important part of sexual health, not just cosmetic care. Recognizing that the mouth is a vulnerable point of entry is crucial for reducing the spread of STI. Using barriers like condoms or dental dams, avoiding oral sex when you or your partner have any mouth sores or cuts, and maintaining excellent oral hygiene can greatly lower the risk. Without these precautions, you're leaving the door wide open for harmful infections to enter. One of the biggest reasons oral sex remains a hidden health risk is the false sense of safety many people have about it. Because it doesn't result in pregnancy, a lot of individuals assume it's a safer alternative to intercourse and therefore requires little to no protection. This belief leads many to engage in oral sex without condoms or dental dams, often with partners whose sexual health status is unknown. Unfortunately, this misplaced confidence can expose both partners to a range of sexually transmitted infections, STIs, that are just as harmful as those spread through other sexual activities. Skipping protection during oral sex is especially risky because infections like herpes, HPV, gonorrhea, syphilis, and chlamydia can all be transmitted orally. Some of these infections can cause long-term complications, such as oral cancers or drug-resistant bacterial infections, and they often spread silently without any noticeable symptoms. This means you could become infected or pass on an infection without even realizing it. The problem is made worse by a lack of public discussion and education. Many sexual health programs focus heavily on intercourse and pregnancy prevention while barely addressing oral sex. This leaves people without the tools or knowledge to protect themselves. In addition, some individuals may be embarrassed to bring up oral sex with healthcare providers, resulting in fewer STI screenings and missed opportunities for early treatment. Protection is simple but often ignored. Condoms and flavored dental dams are widely available and can greatly reduce transmission risk without eliminating intimacy. For those concerned about comfort or taste, there are ultra, thin and flavored options designed specifically for oral activities. Combining these with regular STI screenings creates a much safer sexual environment. Equally important is open and honest communication between partners. Discussing sexual history, testing schedules, and protection preferences before engaging in any sexual act, including oral sex, can help prevent misunderstandings and reduce risk. This conversation should be normalized, not seen as awkward or unnecessary. Ultimately, safety during oral sex requires a mindset shift, understanding that no pregnancy does not mean no danger. By treating oral sex with the same seriousness as intercourse when it comes to protection, testing, and partner communication, you can enjoy intimacy without unknowingly putting your health or your partner's health at risk. Oral sex may be surrounded by myths of safety, but the reality is clear. It carries real risks that can have lifelong consequences. From invisible infections to cancers caused by viruses like HPV, the dangers often hide beneath the surface, striking without warning. Protecting yourself isn't about fear. It's about respect for your own health and the health of your partner. Awareness, honest communication, proper protection, and regular testing turn what could be a silent threat into a safe and responsible choice. Your health is worth more than a moment's assumption. Choose protection, choose awareness, choose life.